So some background on the RHPT project. It's the Rural Healthcare Provider Transition Project. RHPT is supported by the Health Resources and Service Administration and the Federal Office of Rural Health Policy. Janine Myers is the RHPT project officer. And the purpose of RHPT is that we're designed to help strengthen organizational foundation in the key elements of value-based care, not including but limited to including but not limited to efficiency, quality, patient experience, and safety of care. And our goal is to guide small rural hospitals and certified rural health clinics not currently participating in value-based care through advanced alternative payment models to prepare for and position their organizations to be effective participants in a health system focused on value. We'd also like to share that registration for an upcoming RHPT Leadership Learning Collaborative is open. The focus is on advancing value-based care leading from the middle. So this is a 4-part series. It's really focused on participation and discussion as opposed to presentation. So if you are, many of you are from rural healthcare organizations, small rural hospitals, or certified rural health clinics. If you are a manager or know someone at your organization who would like to participate, feel free to register. We're going to put the registration link in the chat in just a moment here. So be on the lookout for that. And now we'd like to welcome today's speaker, Alana Knudsen. Alana serves as Senior Fellow in the Public Health Research Department at NORC at the University of Chicago and is the Director of NORC's Walsh Center for Rural Health Analysis. She has over 25 years experience leading health research studies, evaluating program effectiveness, and translating findings into practice. Her work is funded by federal agencies and private foundations. Alana's passion is to make a meaningful difference in the health and well-being of rural residents and other underserved populations. So I'm going to stop sharing. And thank you, Alana, for being here. We're excited to have you as a speaker again.
Great. Well, thank you. I just want to make sure you can see my slides. Are you seeing my slides yet?
Not yet.
No. Oh, well, just a moment then. We will get those shared here. Are we up and ready?
Perfect.
Excellent. Well, thank you so much for inviting me to share with you some of the things we have learned about rural health collaboration. Just as a brief introduction, the Walsh Center is located at NORC at the University of Chicago, and our center is one of 8 rural health research centers funded by the Federal Office of Rural Health Policy. And I'm delighted to be with you today. When I begin my presentations about rural, I often remind people why rural areas should matter. And for those of you that have heard this, I apologize for it coming up again, but I always want to put a frame in why rural is so important, not only to the people that we serve in our rural communities, but to our country, because rural areas are not only the source of our food, drinking water, energy production, and outdoor recreation, but 1 in 5 Americans and a disproportionate number of those currently serving in the military, as well as veterans, live in rural communities, making the study of rural health needs and challenges of rural Americans essential to all of us. And there is a real underlying message here. There is an interdependence between rural and urban. A strong rural America is a strong America. So we need to make sure that we are addressing the health and well-being of our rural residents to ensure that safety net that we provide to our country. We have 3 different learning objectives for today. And the first one, I'm going to share a bit about some of the rural leaders and their connections to improving the health of their communities through different types of collaborations. I'm also going to share how people use data to not only identify what their community's health needs are, but also to be able to track progress to achieving the goals of improving health. And lastly, I'm going to share some resources because I believe it's really important that you have access to resources and tools to be able to support the important work that you do in your rural communities. And as we go along, if you have any questions, please post them in the chat. And as Molly said, we will also have a Q&A at the end of today's discussion. So with that, I'm going to start with the question. What do I mean by collaboration? Well, our team had the opportunity to create this guide on rural healthcare collaboration and coordination for the Federal Office of Rural Health Policy. And as part of that effort, we defined collaboration as activities in which providers work together through various vehicles. And some of these are more formal in terms of contracts or memorandums of understanding, or sometimes data use agreements. To be able to maximize the resources and efficiencies with a common goal of ensuring access and provision of services to rural populations. And again, this is looking at that kind of higher level issue. So when we think about what is collaboration and why is it important for rural leaders and providers, we know that our rural providers face unique opportunities and challenges. I know of no other place where rural providers or any health providers know their communities better than in rural communities. I also know that rural can be nimble in ways that many large health organizations just can't be. I have seen new workflows introduced in rural healthcare organizations on the turn of a dime, whereas it sometimes takes a much longer time period to implement the same types of workflows in a large system. So we have that nimbleness on our side in many of our rural communities. But we also have some challenges, and those include, we know we have some limited economies of scale. We just don't have the numbers, and especially when you're a data person, sometimes our numbers are really small. We also know that a lot of our healthcare providers rely on Medicare and Medicaid reimbursement, sometimes more than commercial. And in some cases, we also have some very low patient volumes. And as we continue to analyze claims data and look across the country at rural hospitals, we see a declining inpatient volume across rural hospitals, large rural hospitals and smaller critical access hospitals. So we're seeing a lot more shift from inpatient to that outpatient care. We also know that it's very important to look at how collaboration can be helpful in supporting key services. And some of our rural providers have been collaborating to share, for example, therapists that they may have a difficult time supporting on their own, but two different organizations can, for example, share a physical therapist. We have also seen organizations come together to be able to share non-medical services, but essential for ensuring health in a community, such as transportation and access to food. So looking at how we can have those supportive services. And certainly as we shift from volume to value, we continue to see a reliance upon working with our partners, particularly in addressing social drivers of health. And when I talk about enhancing patient-centered care to address social drivers of health, I'm not just talking about in the clinic. We are talking about meeting our rural patients where they are. And I have a really great example of how a rural community came together to address this. I was evaluating a really cool community health worker program in rural Iowa. And I was speaking with one of the community health workers who shared that they had a patient who often ended up in the ED with challenges in addressing her diabetes. And so the community health worker went to visit her in her home. And as they were talking about food issues and beverages and the like, it came up that she had two children, and she said she always kept two different containers, so that one container was for Kool-Aid for her children, And she had a separate beverage container in the refrigerator just for her water. And so the community health worker just said, can you just show me how this works for you and how does it work for the kids? And she opened up the refrigerator and she literally had two pitchers, as she explained, one with the Kool-Aid and one with her water. But the only other thing in her refrigerator was a small bowl of leftover macaroni and cheese. And this really opened up a conversation because the community health worker learned that even though this person knew the importance of maintaining a diabetic diet, she did not have the financial wherewithal to be able to ensure that she had adequate protein and the right kinds of low carb foods to be able to support her diabetic needs. And so that community health worker was able then to be able to connect this family with WIC, with able to get support for some additional food supports in the community so that they would have access immediately to a food pantry, and then get her connected to some more ongoing food supports. So looking at all the different partners that contribute to that, it not only helped reduce that person's ED visits that were identified as potentially avoidable utilization, but it also greatly improved her quality of life and her family's quality of life. So it was a win-win for that family, but it really required that patient-centeredness to understand what was happening in the home, and that community health worker was able to do that. The last bullet on this page refers to adopting team-based care. And what I mean by that is when multiple different health professionals come together and they work together to support the care of their patients. And they not only look at meeting the needs of their patient, but the team members use the full range of their skills and expertise so that you have a full continuum at the table of those healthcare professionals, so that we are using the people most efficiently and effectively to deliver the patient-centered care that we want to provide to our rural communities. I also wanted to share the definition for coordination, because I think this is helpful to see how collaboration and coordination are envisioned to be just a little bit different. And this is really at the organization of patient care activities between two or more participants, that team-based care I just talked about, in a patient's care to facilitate the appropriate delivery of quality health care and social services and other supports that a person may need to be healthy in their community. As part of our guide, we developed 4 different elements, and I want to share this with you because on the previous 2 slides, I also had links to this document, and this is available online, and it not only has the background information for the guide, including 2 case studies, and I'll talk a bit about some of those the case studies in a bit. But it also has some really great tools and resources so that you can hopefully just pull the guide and look at some supportive documentation and information to be able to help in your efforts to address collaboration in your community. And, you know, we always begin with analyzing what the environment is to really understand what our different organizations can bring to the table, and what their motivation is, and also what are they funded to do? Because at the end of the day, we all have day jobs, and we have to be able to not only carry through with our mission, but in order to be an active contributor, we have to have some resources behind us to be able to really come together to address the needs of our communities. Another component is really understanding what the environmental drivers are including not only national policy and state policy, but sometimes we have some local issues that we also need to consider as we're looking at bringing groups together to collaborate. One of the things that I think is really valuable in our rural communities is that there are a lot of existing partnerships and relationships already there. But the flip side of that is that when people retire or leave for other employment, we sometimes lose those partnerships because they're based on two leaders or two personalities that are used to working together. So we need to think about how we can engage potential partners, not only just the people that are serving as leaders in those organizations, but how can we think about including those organizations going forward, even when those leaders change. And one of the best ways that we saw that was very effective was really bringing people together with that community-minded approach, where we recognize there is not one organization in our community that can address all the needs that we have, but collectively we can make a difference and bring our unique resources and talents and expertise to the table to be able to move our efforts forward. And that's really where element 3 comes in, where we develop a collective strategy, where we again have tools in this document where it can help facilitate collective discussions with partner organizations, including issues like transparency, what are roles, what are responsibilities, and what are expectations when people come together to collaborate. And sometimes if there are some additional resources that can be brought to bear, a trained facilitator is really helpful if you are looking at addressing a particular issue or a really large scale issue that will be addressed over time. Having somebody from the outside as a trained facilitator can allow for all participants to have a voice at the table. We also know that selecting meaningful measures are important, because one of the things that came into play through our interviews was that oftentimes people did not know if they were succeeding, if they were able to make progress. And so being able to identify meaningful measures that people can not only track as a baseline, but be able to follow over time is really, really important. And lastly, reviewing requirements and seeking technical assistance. And again, I will go into a little bit more detail on this one, but every organization has their own programmatic and regulatory compliance issues that they need to ensure that they are doing their due diligence to address. And so whenever we bring people together to collaborate, we also need to keep in mind that every organization has its own limitations as well as its opportunities to contribute. And there are often technical assistance supports out there that can help support collaborations. And one of the things that we learned after COVID was that a number of foundations are much more in tune with the need to support capacity building in rural communities. And prior to COVID, a number of foundations were not as interested in funding, for example, that convener role that brings together people to be able to address issues that are broad-reaching issues in a community. And now after COVID and understanding a little bit more about opportunities to build capacity and enhance the infrastructure, there is more interest in funding that capacity building and supporting, for example, collaborative entities. So as you're thinking about issues that you and your colleagues would like to address with partners in your rural communities, also think about the different potential of reaching out to your philanthropic partners. But at the end of the day, no matter who we interviewed, the comment was, everything is based on relationships and everything is based on having trust to move forward. This next slide represents some thinking that Daryl Birch, who is a retired critical access hospital and shared FQHC CEO, shared with us. And he talked about 3 different legs of a stool that is built on trust. First of all, how do you put together an environment that is supportive of a trusting relationship? And it needs to be functional. There has to be an operational and in some cases a clinical alignment to best serve your shared communities while maintaining separate provider organizations. And this was specific to what he was implementing in North Dakota. At the time, he was the only person in the country who was a CEO of a critical access hospital and a CEO of the FQHC. So these were foundational for him to be able to serve in that role. He also spoke about the importance of seeking legal counsel whenever you are looking at any kind of collaborative engagement that has any kind of commingling of resources, just to ensure that it's very transparent and that everybody is on the same page. We all have conditions of participation to address, and making sure that we have those legal specificities in place so that we know how to move forward and those expectations are clearly laid before you. And structurally, looking at shared board members, with his 2 organizations, there were shared board members so that there would be a bridge between the boards as well as having him as the CEO of both organizations. So thinking too structurally, I know a number of, for example, rural hospitals include a local public health department leader on their boards. And likewise, the local public health department includes a representative or a leader from the rural hospital or the rural clinical organization. So there are opportunities to think about how you can also have shared membership in these leadership roles. So let's shift gears a little bit and talk about multi-sector collaborations. And to me, this is what is really super exciting. This is a primer, and you can find this resource. The link is here, where we look at how to leverage current partnerships, build new collaborations, all based on finding common areas of interest. And I just wanted to share a really neat example from Illinois, and they're in the Delta area. And this is between 2 hospitals, the Marshall Browning Hospital and the Pinckneyville Hospital. And they came together and each had a community champion. And that the community champions from each of these hospitals was charged with building community partnerships to address social drivers of health for the patients that they served. And they did this in part through a community coalition called the Transition to Coalition. And this particular coalition was really focused on addressing homelessness in their rural communities and trying to understand what some of the root causes were of that homelessness. And so on this coalition, in addition to the hospital representatives, the community champions, they also had law enforcement, other types of mental health providers, local health departments, and education. And what is really fascinating to me, I interviewed a rural FQHC in Kansas, and they shared with me that the underlying issue that they found through their needs assessment, trying to better understand homelessness in their community, was education, and specifically reading levels. And so they are in the process now of bringing together a team to identify how they can best serve those unmet educational needs to best support people who are homeless and who need some additional support in improving their literacy. So it's amazing to see how these different multi-sector collaborations can come together so that people can ultimately be healthy and improve their well-being. In doing so, there's a whole list of different multi-sector partners that you may consider bringing to the table, depending on what the common issue is that you want to address in your rural community. The vast majority of multi-sector partnerships that I have had a chance to learn about in rural communities included representatives of education and economic development, as well as the social services, housing and transportation, and of course the different types of faith-based organizations, justice, including first responders, public health departments, cooperative extension, and some of the other service community organizations such as Rotary and Lions, and then of course tribal agencies and other organizations that are committed to participating in improving the health and well-being of the communities where they are located. And again, all this information is available in the slides, which you will have access to. Another important partner that I have found that is often not included in the list is the National Guard. They are always the people who most of our rural public health folks work with and healthcare work with during times of response following disasters, and certainly during our most latest experience with our public health emergency. There's also a really important component underlying collaboration, and that is leadership. And we are at a time in our rural communities where we really need to develop not only today's leaders, but the leaders of tomorrow. And again, there is a link for this particular resource on how to build rural health collaboration capacity through developing rural leaders. And I wanted to share with you a really interesting effort that is happening in rural Colorado through the Butcher Foundation. And they have two different efforts on building leadership capacity. One is called Doers and Difference Makers. And this is a 9-month fellowship that connects community champions. And it's not just health champions, it's across, again, multi-sector leaders, and brings them together to help provide skills, to help create a network, and help also to support people as they take on greater and greater leadership roles in their community. Through this, they've also established leadership collaboratives. And the two leadership collaboratives that are in place now are called Rural Leaders and Leadership Practitioners Collaboratives. And these are learning communities. These are volunteer. They include nonprofit, health, government, education, business leaders. And it's really an opportunity, again, not only to grow our leaders where they are today and help provide them resources and a peer group, but also looking at how do we support our rural leaders in bridging. For example, in Colorado, they're looking at how they can best bridge rural and urban communities to make them the healthiest they can be. How can they do that? So I think it's really interesting that this foundation is making these investments in rural leaders to look to how they can best support leaders and grow leaders so we can address the number of leaders that we now are seeing due to retirements as the baby boomers retire, as well as looking ahead when we know that we're going to have some large demographic shifts. So investment in leaders is key to success in rural collaboration. And it's really important to bring our young leaders to the table now so that they are well positioned so they can take over leadership positions into the future. I'm going to share a few fun collaboration examples. The first picture is actually from Thrive Allen County, which is located in Kansas. And this is a coalition that supports and encourages programs, policies, and resources to promote access to healthcare, healthy lifestyles, and positive communication. And this is all to achieve their vision of becoming the healthiest rural community in Kansas, physically and fiscally. And so as part of Thrive Allen County, not only do they have people from healthcare and public health, they have economic development, education, recreation, and social services all coming together for the betterment of their community. And what's really cool about this picture, the top picture was taken when they were all gathered for a barbecue when a physician was interviewing for a position in their community. And so this represents local education, local business, the banking community, as well as public health and healthcare to provide an opportunity for that prospective physician to be able to meet and greet the community that was welcoming them to serve. Another great example is the Healthcare Collaborative of Rural Missouri, and that is featured in the guide that I shared. And I think what's really unique about this particular organization, I think it reminds us that sometimes we start really small and we have a chance to grow. And in 2003, one of the local public health department leaders convened a group because they were looking at creating a senior center. Through a community needs assessment, they identified that there was no place for the older adults in their community to gather together. So they decided that it would be an opportunity to enhance aging in place in that rural community if they established a senior center. And as part of that, they had people from all different sectors, again, of the community. It wasn't just public health, it was healthcare, it was people representing different groups in the community. And one thing emerged from that initial discussion, and it was that there were a number of unmet needs in that community. They recognized they didn't have access to behavioral health services. There was no oral health care. There was limited access to primary care. And so this evolved and then provided the seed for developing a federally qualified health center, which they did. And over the last 21 years, that initial effort has translated into the Healthcare Collaborative of Rural Missouri that now employs 50 people, has over 70 different partnerships. They address issues from job training to addressing needs of those who have been recently incarcerated. They provide education, food, address issues with homelessness. The collaborative is wide-ranging and wide-reaching to be able to support the needs of their community. And in fact, they just recently built a huge warehouse to be able to store community donations and be able to be a place where they can bring people together, for example, job fairs and one-stop experiences so that people can be able to get registered for different types of programs, make linkages with different types of educational opportunities and job training, as well as identify transportation. It's really looking again at meeting people where they are, and bringing the whole community together. And our rural health leaders are key at the table, but they are not the sole ones addressing all of the needs. So I just want to make sure that everyone's clear on that. In rural healthcare, there is so much to address, but please know you are not on the hook to address everything in your community. It's really important that these types of collaborations involve many different voices as well as other partners, because there are people who can leverage their resources to better serve and best serve effectively and efficiently in your community. So when you look around your table, what are your rural health superpowers? A number of you are completing community health needs assessment and looking at developing strategies for your community. How can you be the convener, bring people to the tables, have different partnerships? We know that emergency preparedness is something that a number of our organizations in rural communities are charged to address. How can we use that emergency preparedness as a way to bring people together as a collaborative activity, not only to address those needs in times of disasters and emergencies, but how can we continue to learn from them and be better prepared for the next event, because we know it will be on our doorstep at some time. Also, telehealth, that has opened up a whole array of opportunities in our rural communities. How can you use that superpower to be able to support collaborative activities? Likewise, community health workers, another great way to be able to make connections across sectors in our rural communities, as well as mobile health units. I was informed of a rural community that has a mobile health unit that has a place to address behavioral health, oral health, and in the process also brings vaccines. So looking at how we can leverage those different activities and meet people's needs where they are using mobile health units. And are there others? Please post them in. I'd love to hear what your superpowers are. In these types of webinars, it's really helpful for me to hear what is working well in your communities. Also, I have a list of some questions for you as you're working with your rural health collaborative in your community. And these are reflective questions that you can ask anywhere in the process. You know, are we engaging with organizations and groups that serve communities that may experience inequities or disparities? Are we bringing everybody to the table? Are there different types of groups that we don't always think about? And I'll give you one great example. That's libraries. Texas, if you look at our preparedness toolkit on RHI Hub, there's a great example that showcases what happened in Texas during that horrific winter storm when the power grid went down. One of the ways that they were able to sustain communication in a rural community was through the library. The library was well connected through social media and was able to provide important, timely information about where to access food if people were in trouble, how to get different types of transportation or to meet needs. So think outside of the box. Who might be some partners that you traditionally haven't included in your collaborative activities and might be able to provide resources that could really be valuable to your collaborative endeavors. Also looking at these, as I said, cross collaborative or cross-sector, multi-sector partners. One of the things that our healthcare collaborative from rural Missouri said she really appreciated cross-sector collaboration because she thought it was really important for accountability. She said it really provided a great opportunity and a great opportunity for everybody to share what they're doing. And, you know, I think the last bullet is so important to consider. What are your plans to sustain a collaboration over time? And as I mentioned earlier, we know that people and leaders may change in organizations, but our commitment to have healthy, vibrant, economically viable rural communities remains. So how can we ensure that we are going to continue these collaborations, even when the people at the table change, but we want to keep that organization and keep that collective energy going forward. And of course, I have numerous resources for you, and some of you know them. We do all of the RHI Hub toolkits. This particular toolkit, the Rural Community Health Toolkit, has some great information on collaborative activities. There are also some considerations because not all collaborations will necessarily yield the result that you are hoping for, but having these considerations are important. Our toolkits are all designed in a modular fashion, so you can click where you need information, whether you're just looking at beginning a collaborative endeavor. You can look on this particular module in module 3 and see how you can put together different types of community health programs and collaborations. We have a number of different toolkits available by topic. One of the things that we know well in rural, it takes a village. We all have partnerships, and every single one of these toolkits has examples of partnerships and collaborations that have worked together to achieve the goal of, for example, providing options for transportation or looking at how best to integrate services. So wherever you happen to be in your community, there is an example of a partnership or collaboration that may work for you. Lastly, we have our Rural Health Equity Research Center. All of our research is available here. And the National Organization of State Offices of Rural Health has established the Rural Health Capital Resources Council project. This also has a number of resources related to other types of collaborations in rural communities that have been successful, including Federal Reserve banks, community development foundations, just a whole host of things. As we know, housing is important. How many rural communities have you been to that says recruiting for health workforce is challenging because we don't have adequate housing? Well, there are examples on this website of communities that have been successful in securing funding as a cross-sector collaborative to be able to improve access to housing, for example, in those rural communities. Please take advantage of those. Those are also funded by the Federal Office of Rural Health Policy. And we'll move into questions. And just so you know, if you need any additional information, you can contact me at norc.org or by cell. And with that, I will stop sharing and maybe we can entertain some questions and look at the chat. Are there any questions?
Keep an eye on the chat if anyone wants to put their questions there too. There's been some great comments, Alana, just from your presentation, so.
Hi, this is Chris Ann with Greeley County Health Services in Kansas. We are preparing to do, I think, our 4th or 5th community health needs assessment. I should look that up. I don't want to just replicate the same old survey that produces the same old results. I would be really interested if anybody has some surveys or some assessment tools that they've used to assess programs that have been put in place to attempt to respond to last year's CHNA or the the last CHNA, if that makes sense. So it's just a quick example. We had heard about behavioral health. We've heard about that every year. And we have done a number of telehealth programs and community education and have just now recently hired a therapist. We'd like to assess, do people know about it? Are they hearing it? Do they feel it's accessible? Rather than just simply saying we need behavioral health again. Thank you.
Well, I can tell you one of the local health departments in my home state of North Dakota, they serve 7 counties, 5 of which are frontier. And they, as part of their needs assessment, they conducted focus groups. And in part because sometimes it is really hard to get people to answer those particular questions. And so they were able to get some very rich information. And one of the things that they asked about, it was not only, to your point, a question about are there adequate mental health or behavioral health services available? They were also able to ascertain information about what is needed. And one of the things they found out was that when there were issues of suicide, people were waiting up to 6 months to be able to access an appointment. And so they were able then to put together a fast track to be able to address those crisis mental health or behavioral health needs that to that point had not been addressed. So I would also consider looking at conducting some focus groups to get some rich information about how people are using your services. There are also some great examples. One of the things our folks, our colleagues at NOSOR can also share some great community health needs assessment. I know that the North Dakota Office of Rural Health and the Montana Office of Rural Health have done a great deal of work in supporting their rural hospitals in their states, and have been able to help expand the kind of information that they have been able to glean to better address their rural community needs.
I do see a couple of questions in the chat. Where do you see the role of area health education centers and rural health collaboratives?
Oh, I think it's very important to have AHECs in rural collaboratives. You know, we are at a workforce crisis in many of our rural communities. I have had the experience of raising a parent who has been in a nursing home, and the challenges in having adequate nursing staff in a lot of our rural communities. And it expands beyond health, you know, the traditional hospital and clinics. Our nursing homes are in dire need, and AHECs are so important. It's also economic development. And, you know, folks, I think we have to be really thoughtful in how we are also addressing needs in our communities. And there are different funding sources through economic development that can also help to support education. So, you know, when you're thinking about bringing your educational colleagues to the table, especially AHEC, I'm a big fan. I'll also think about the opportunities to leverage some rural economic development funds that can be used for training and education.
Thank you for that. I think there was one more. What has been the best way to organize an initial meeting of individuals that represent the community for collaborative initiative? Doesn't NRHRC offer a community health needs assessment service? I've been a two-parter.
Well, I will let you answer the resource centers because I think there may be some resources through TASK. Is that correct? And through some of the work that you all do in Delta and now the sustainability work, is that correct?
Actually, I see Rhonda. Thanks for responding in the chat to that part.
Yeah, I put
Excellent.
the link. Yeah, I put the link for the community health needs assessments services in the chat. Thanks, Bill.
And also about bringing people together. I think I will tell you my secret sauce for bringing rural groups together: food. I think the most important thing you can do is gather together around a meal, and be at lunch. Lunch is a great time to get together. Especially we know that rural people wear multiple hats. So getting together around lunch and doing a little bit of homework before you bring people together is helpful to identify what kind of resources they have, as well as what kind of limitations people have. So, as I said, the example that I shared about addressing homelessness, everybody in that particular coalition is focused on homelessness and what different resources they have to be able to contribute to finding solutions, particularly addressing the root causes. And a lot of the root causes have to do with education and opportunities for livable wages through employment. I can tell you, I have been part of a number of rural coalitions. No one has ever done anything solely on their own. It takes a lot of different people contributing. And time is an important factor. And please think about connecting with your philanthropic partners. We all have day jobs and we all have expectations for day jobs, and convening people takes time. It's a coordination factor. There's also sometimes if you're going to have food, you need to pay for food. Also, some of our folks, especially in a lot of our, I grew up in Frontier, North Dakota. You have to drive a long way to get to a convening place. And, having an opportunity to pay for transportation costs or mileage, that may help you to hear voices that otherwise might not be at the table. So also think about, how can you best leverage resources so that you can bring people together and really identify solutions that are going to meet the needs. Can I tell you one that didn't work so hippity hop? That's a technical term. I was working with an organization and they had all come together and decided that they wanted to provide ancillary healthcare training for displaced coal miners. Now, the challenge was they didn't ask coal miners if they wanted to work in healthcare. And what they found through the process was because of the expectations with some of the math and science that people needed, some of the coal miners needed some remedial education to be able to get them to a level where they could, start some of the college courses to be prepared for that. But they also found out that this was not necessarily work that was interesting or desirable. And so this particular organization within a year totally shifted what they were doing after they talked to the coal miners in their community and realized that training for healthcare, especially ancillary healthcare services, was not the solution that they thought it was going to be to address the employment needs for the displaced coal miners. So, those needs assessments and identifying, what is the problem you want to solve? Sometimes, it's sort of like beauty. We sometimes have different perspectives of what that is. So, having some good data, as you all know, I'm a pocket protector at heart. And so, and I understand some of you may not even know what a pocket protector is, but it is something that you identify with a nerd. And I really like data to be able to inform decisions and to serve as a baseline. But sometimes that data is kind of hard to get. So what I would do is go to my partners. I would go to local public health. I would go to the state health department. I would go to, you've got some wonderful state offices of rural health. You've got also local colleges and universities that are just looking for projects for their students. And where better for them to learn than in your rural community?
You can keep the questions coming. We still have a couple minutes yet. We did launch our post polls if you wouldn't mind giving your feedback. And I'm also going to put a link to our survey if you'd like the ACHE credit. Feel free to fill that out. We'll also send it in an email when we send out the slides, but keep the questions coming.
Hi, I just wanted to offer, I live and work in a rural area, the Upper Peninsula of Michigan. And this is something that we've been working on for years. And it is frustrating, but we're finally getting there. So I just want to offer a little bit of advice that we started bringing some of those stakeholders and relationships to the table for like a summit. And then we did a deep dive into those needs. And then we were able to form a committee after that and start working on those needs one by one. And so, you know, it's taken a lot of time to try and break down some of those silos and get the right people to the table. But once you find them, your work then starts to amplify as you connect with others that are trying to serve in the same way. Because we have 15 counties and no 2 counties have the same resource. They all have new barriers. And so I just wanted to throw that out there. It does take time, but building upon those relationships and starting with like a larger group and then start working your way down to those finite gaps and barriers, and then pulling those people and leaders in those realms, whether it's substance use or pediatric, or for us, it's a mental health collaborative that we've been building. So I just want to throw that out there.
That is fantastic. And I just have to add,
And
your
play
comment
with a
about identifying important,
actual card.
I would say identifying early wins. A lot of times people just keep going and going and going, and they don't necessarily
Great.
get the momentum they need. So that's awesome. Also, Bill had a great comment about assets. In one of my former presentations for this group, I did a whole section on strengths and assets. So there is some also background material on that, if that would be helpful, because every community has strengths and assets, and we need to make sure we leverage those.
Well, thank you, everyone. This was really great discussion. Thank you, as always, Alana, for presenting. This was a wonderful webinar you gave us. So thanks, everyone, for being on. We will send out the slides and the recordings shortly. We'll have another webinar in February. We'd love to see you join.
Awesome. Thank you.
Thank you. Have a good rest of your day.